We've been talking about the latest research into an emerging treatment and possible protective shield against being infected by COVID-19. Now, an emergency room doctor is speaking out about using the combination of hydroxychloroquine and Z-Pak on himself after he was likely infected on the front lines of this pandemic. After experiencing severe symptoms and testing positive for COVID-19, Dr. Jake Deutsch prescribed the protocol to himself. And after 2 weeks of treatment, he is back at work, battling this dangerous virus that he now understands firsthand. Dr. Deutsch joins me now via Zoom from Cure Urgent Care in New York City, where he is the founder and director. How are you feeling today? You actually look pretty good.
Yeah, no, I'm definitely on the recovery side of this horrible illness. I feel great. I actually have tons of energy. I kind of went through the ringer. I definitely didn't have a mild case. I was very, very sick. I had bilateral pneumonia on both sides of my lungs, and was very, very scared. So I have come full circle. I actually feel like I have more energy than I did before I got sick. I think part of that is just being so grateful to be recovered and want to get out and do good. So doing really well.
So your symptoms lasted 2 weeks. Could you give us a little bit more of a feeling of what it was like?
Sure.
You mentioned energy as one example, but I suspect your breathing was challenged as well.
Yeah, I was actually thinking, I want to get this and get done with it so that I could be on the front line. I'm an ER doctor. I'm seeing patients that are being diagnosed with corona all day long. So I got sick with mild symptoms for the first week, some body aches and fevers, kind of just going through the process without much concern. On day 7, I really hit a wall. And I went to the ER at Mount Sinai, where I had privileges, and checked myself in as a patient, which was incredibly scary. And at the time, we did an X-ray. I saw pneumonia on both sides. And that's when things really got difficult. And I was really quite concerned because not only was I sick, but my 77-year-old father is in an ICU in Las Vegas because he had been sick from corona as well. So managing my own recovery, dealing with family that was critically ill, and also having a practice that's on the front lines and making sure that we stayed healthy and safe as a group in order to help others.
So along the way, as someone who's knowledgeable in the field, you decided to take the drug combination, hydroxychloroquine and azithromycin.
Yes.
Why did you decide to do it? What side effects did you experience?
Sure. Well, I was most concerned about having pneumonia on both sides. As a clinician, diagnosing somebody with bilateral pneumonia usually means hospitalization. So I actually was consulting with my father-in-law, who's an infectious disease specialist. We looked at the literature. We were able to make a determination that it made sense for my particular illness, and then started taking the treatment. I got to say, I did not have any side effects. I tolerated it well. And I repeated my X-ray 2 days later at 48 hours, and it improved. So again, this is anecdotal. I can't say that taking the medication or treatment made a difference in my recovery. All I can say is that I got better. And of course, we're being very cautious about sending information to people or sharing information that everybody should be taking it, because that's not the case. It's a prescribed medication, so we have the issue with making sure that you're getting treatment that's prescribed to you. Additionally, there's not enough medication to give to people. And also, we want to make sure that people aren't causing harm. So potential side effects. It is essentially an immunosuppressant.
So I know you mentioned your father-in-law. Your partner also recently was diagnosed after, in his case, more mild symptoms. So just in your own family, who gets the treatment? Who doesn't get it? Did your partner get it? Did your father get it?
Partner did not. Mild symptoms, 3 days of fever, was essentially better after that. My father, that's who was in the ICU, did get the treatment. And, we believe that was part of the reason why he improved. He actually was ventilated for a week and was extubated about 5 days ago. So the decision to go on a ventilator is never easy. And luckily, he's been able to get off the ventilator. So a little glimmer of hope. We can't say with definitive information that the medication made a difference, but it definitely seems promising for people who are critically ill. So we need to continue to study it. We need to gather as much data as possible to show what's working and what's going to make a difference.
You have so beautifully articulated the dilemma we all face as clinicians. I appreciate you sharing your personal story. It brings it alive to a lot of the viewers. We're praying for your dad. I hope he continues to recover.
Thank you very much.
We'll be right back. Be sure to subscribe to my channel so you don't miss anything. And remember to check back often to see what's new.